Hi, Amy. So from previous assessment, it shows you have a mild stuttering, and also you have above average anxiety level. And so because of this, I would recommend you two things. To go through the Camperdown program, as well as within that, you could also do modified CBT. And so what is the Camperdown program? So the Camperdown program is basically it's a stuttering program. It's for your stuttering. So it will help to change the way that you speak to be more fluent and natural. And it has 4 stages. Um, it has, the learning stage where you learn about your the fluency techniques, and then the fluency, and also the stuttering severity scale, and also the fluency scale. And so the fluency scale is, from 0 to 8, 8 being the maximal technique. If you use the maximal technique, so that will sound more unnatural, but it will lead to reduced stuttering. And also at the end, that's not the end goal. We're gonna try to aim for you to have a fluent speech in different contexts. So in the second stage, you're going to practice it in the clinic, make it your own and make it natural. And then in the third stage, you're going to try to generalize it outside of the clinic. So at the third, and then lastly, at the fourth stage, you're going to try to do a maintenance stage, and you're going to fade out the one-to-one consultation. I'm going to try to practice it on your own. So, at the end, you're going to be more natural with fluent speech. But specifically for this program, you're going to practice it in different scenarios. I would think it's beneficial if we target scenarios where you stutter the most, which is when you take work-related phone calls, do formal presentation and read out loud, because those 3 situations is still essential for you as a medical student. And within this Camperdown program, we could also do modified CBT, which is where you unpack your negative thoughts, and also put those thoughts into perspective to manage your anxiety level, and at the end will improve your quality of life. Both of these intervention has shown to be effective in helping adult who stutter, and also I'm also well trained in providing both of this treatment, and it could also be done. Research shows that it could be done in telehealth platform, so that will be flexible for you as a medical student. And if then I like to mention that the modified CBT has an internet version of it, which is actually free, so that will reduce the cost for you. And also, so yeah, so that's the overall idea. What we're gonna do. Do you have any questions, or how do you think about that? And I'm just gonna demonstrate to you how maximal technique supposed to sound like. So if I say welcome to your first session, it's supposed to sound like this. Welcome to your first session. I know it sounds very unnatural, but again, you're not going to expect it to do it outside of the clinic. And at the end, you're going to sound more natural and fluent.